So here's an additional article. This is the Harvard International Review, Changing Up the Checkup, How Concierge Medicine Can Re-Energize Primary Care. So this article addresses one of the main points in my research question, which is how the healthcare industry is suffering from an extended shortage of primary care providers. Recent research of the Association of the American Medical College shows that the United States will face a shortage of up to 49,300 primary care providers by 2030. So it appears that this number is growing, that the shortage in providers is growing, which is in support of my research question as well. This also looks like it's going to talk about how concierge medicine can be used as a solution to this shortage. So I think it starts, let me see where it starts here. So it starts to reference concierge medicine here, and it talks about some of the critiques of concierge medicine as well, how there may be wealthy clients who can pay the fees for concierge medicine, but that the benefits may be inaccessible to the middle or lower classes. Let's see. It says here, though, that in pilot concierge practices at hospitals across the country, many of these issues are being addressed once again. So I think one thing that's important in this is to look at the context of the practice. Is it, a small single provider practice that's only going to be able to manage a very small patient population? And I think in that context, the concierge medical system the benefits may not be as apparent, or there may be even some disadvantages to that system as opposed to our current medical system. But let's see here. It looks like Massachusetts General Hospital initiated a concierge medicine program in 2016, inviting members to pay $6,000 a year for 24/7 access to physicians, with a much more manageable patient panel, it looks like, of 300 to 500. And that's at any given time. And then there was an interview conducted about this where the hospital's chief marketing officer noted that the program's biggest value is its offer of time, a benefit that the doctors and patients both appreciated. The longer appointment times and increased accessibility allow patients and providers to better work towards preventative care rather than illness-centered care. I think this is going to be a critique that a lot of people have of our current system, is that it's really just prescription heavy, like diagnosis heavy, and it's only treating illness. It's not focused on any sort of preventative care to keep us healthy. It's only treating the symptoms of, illness in this country. So, so that it makes note of that's one benefit that they saw after implementing those concierge practices. Let's see what else. It says that this concierge program has been successful in growing its patient population and drawing additional physicians. So that sounds like a good thing. It sounds like the patient population is expanding while still providing physician satisfaction. And the practice is able to support itself, the self-sustaining revenue generators. So I think that's really important too. It's not relying on any sort of funding externally. It's able to be self-sustaining as its own entity to continue serving these patient populations and continue employing these physicians who, both are seeing satisfaction from the concierge system. This article is saying that the concierge programs implemented there in Massachusetts hold a lot of promise for their primary care system in solving many of the root causes of that primary care provider shortage. So down here it's talking a little bit about cost. I'm just trying to see exactly how this could be this could be used to reference like my actual research question. So I'm just going through this a little bit. Cool. So this is also referencing how the money saved in these from the retainer fees can be used to subsidize other maybe marginalized areas. This one's referencing substance misuse disorders and other community incentives, which I think that's great. But ultimately, if I think it can also be used to subsidize and provide accessibility to its own facility. So I think the payment that it takes from its patients who are able to afford it, I think it can transfer those benefits to the lower income patients who don't have the ability to pay for some of the retainers for the concierge medicine. Yeah, so this is just a relatively shorter article. It just touches on the primary care physician shortage and how concierge medicine may be a viable solution to alleviating some of that shortage. And then it provides that anecdote about the Massachusetts, I think, General Hospital and their success that they've had in implementing that system.